Let me know if you can see my screen all right.
I can see it and hear you.
Oh, perfect, perfect. All right, well, welcome everyone. As Amy said, my name is Kailyn Dorhauer, and I'm with the Office of Rural Health and AHEC. So in Bozeman, located at Montana State University, and right down the hall from Amy, who's with the RHI. So conveniently works out that we're trying technology across the hall, and so as long as this works, then we'll like this webinar tool that we're using. So to get started, I just want to offer a little disclaimer that by all means, I am not a mental health expert. I did my master's in healthcare administration, but I am not a provider or clinician in any sense. But I want to be able to offer what I've learned in the last couple of years to folks across the state in being able to provide resources for people to utilize in their communities. And specifically, we work with more of our rural communities across Montana and what they can tap into and utilize to help their community members in regards to mental health. So with that, I want to just start off by laying the groundwork of where we're really seeing mental health illnesses across the United States. And so I have a few statistics that I'll share with you guys, and I'm sure that you've heard many statistics regarding mental health, and it's a lot of times kind of brings us down because the numbers are so overwhelming, but there are ways to try and help folks out there that are experiencing mental health problems, and so that is what we want to focus on today as I go through the webinar and offer some resources that I've learned about. So this first slide here, we have the prevalence of mental illness in the United States, and approximately 1 in 5 adults in the U.S. experience mental illness in a given year. And it just hits home for me because you think of families where you may be 1 of 5, and that could be any one of you. And so it's not something that is uncommon by any means, but it's also something that is really stigmatized, and a lot of people aren't sure what to do or what standpoint they should take or what information they can offer people who are experiencing mental illness problems. And so I just want to really make it clear that mental health problems are way more common than we may realize at this point. So also, and I have all of the sources here from these statistics, and as I go through the presentation of where the information has been pulled for and where you can retrieve it as well if you would like to share it with other people or look into using it for yourself. So all of the sources are listed at the bottom of each slide. But approximately 1 in 25 adults in the U.S., so 4.2% of our current population, experience a serious mental illness in a given year. And so again, I'm just trying to hit home the point that this is something that we see every day, every year, and within a small community, it could be several of us that are living in that community. And also mood disorders, so including major depression and bipolar disorder, are the 3rd most common cause of hospitalization in the U.S. for both youth and adults aged 18 to 44. So we see across the state that this is high utilization in our hospitals, but we also are addressing the fact that not enough people are seeking treatment because they're unable to identify that there may be an underlying problem, or also that they feel uncomfortable seeking treatment and looking for outreach for issues they may be experiencing themselves or for family members. And you think about growing up in a small town or living in a smaller town, if you see someone's truck parked up in front of the mental health center, for instance, then you might be able to identify that person or wonder, or you feel uncomfortable even going to see a provider because they say, "Oh, Joe, I saw you were at the doctor. What's going on?" And we hear that so often across the state when we are working with communities, especially in regards to mental health stigmas, that people are afraid to face them, and also afraid that their community members may also be aware that they could be experiencing some problems. So we want to be able to address this in in a way that makes it more of a community-friendly approach so that people feel more comfortable and are more well aware of what mental health issues do occur and how we can address them in a more appropriate manner. So here are some statistics that I also want to share from the Substance Abuse and Mental Health Services Administration, and they came out with a Behavioral Health Barometer report in 2014, and this shows that where Montana compares to the United States in regards to mental health prevalence and case issues. So this is the past year, so in the past year of when this was reported, from 2013, serious mental illness among adults aged 18 or older, and so how common this is in the United States and then where we're sitting at in Montana. And so we as a state are noted in the blue. And several of you, I'm sure, are actual mental health experts, so these statistics may not be new to you, or you may see them on a daily basis or see others as well. But a lot of things we hear when we are across the state traveling that, a lot of folks say, oh, Montana, we're in such bad position with mental health resources, and our statistics look terrible compared to the rest of the United States. And honestly, from my opinion here is, the whole nation is experiencing this struggle, and we're trying to be able to address it through multiple avenues. And so where Montana, we may have high statistics in regards to mental illness prevalence, we're really trying to address them at the growing rate that we are seeing the issues across the state. And this chart here then shows in the past year of the reported date, the serious thoughts of suicide among adults aged 18 and older in Montana, and then also compared to the United States as well. So again, higher than what the U.S. average is showing from 2009 to 2013, but there is, we are addressing suicide rates as well in the state, and as I'll get into this later through the presentation, hand in hand, suicide rates and mental health illnesses do go hand in hand. Excuse me. So one thing that we can do for those who are experiencing mental health challenges is being able to recommend or offer treatment. And it's just tough. We live in a frontier state. Not all places have mental health resources available, but I think one thing about Montana is we can get really creative, and especially in our rural towns where if you have that community feel or community members who are invested in the health care of those who live there, we certainly can be creative in making sure people are able to receive access to care. And from this chart here, you can see it states the percentages of those who received treatment in Montana in regards to treatment for mental illness and those who did not receive treatment. So it's almost half and half and reported in 2013. But a lot of times what we've found and heard is that people don't necessarily know where to go to receive treatment, or they honestly don't know that they have a problem. And maybe they are either experiencing things that they're unaware of who to approach about it, or they have always experienced these things, and so seeking help does not seem like a normal method for them to go about because they didn't realize that they could feel better if that was what was going on. And then also this last slide from SAMHSA shows that, make sure I'm on the right slide too, the mental health consumers in Montana, and for those who actually received treatment and received assistance, how they were improved or reported feeling that improved functioning. So while we don't have all of our population who suffers from mental health illnesses seeking treatment, the numbers of those who are seeking treatment have reported substantial improvement in their current case, and you can see that here, along with the rest of the United States. So that's a positive note to lead into this next part, because it's very often we do feel down about our numbers, and so I just want to make it clear to everyone that there is hope, and we are certainly working on it as a state. And those that are receiving the treatment have reported that they have benefited from it. So this next slide here that I'm on shows the workforce data, and this is from 2010, and our office is currently updating this data that will reflect numbers from 2014, 2015, but it shows where our workforce is in regards to behavioral health occupations. And so one thing I want to note, even though this data is older, the county health rankings that came out in 2015 said that our Montana's ratio of population to mental health providers is 428 to 1. So it doesn't take a mathematician to understand that we have a shortage of behavioral health specialists and those that are working in mental health areas to be able to address our population's need. And I know that our schools across the state are working hard to be able to offer more programs in order to get people trained and to see these populations. As I said before, we have a very rural frontier state. In some areas, it's hard to get someone who's working in the healthcare field placed out there. And so what else can we do outside of those that are working within the walls of mental health facilities to be able to reach our community members? And we will pop into that. And here's another map from the strategic workforce plan that I mentioned that shows our number of psychologists in Montana from 2010. And interestingly enough, 55% of the U.S. counties do not have any practicing behavioral health workers, and 77% of those counties reported, or of the U.S. counties reported, that they have unmet behavioral health needs. And this, again, is from the Substance Abuse and Mental Health Services Administration that's reported on the national shortage. So we do see a shortage here, and the whole United States is seeing the shortage as well. Okay, so we have resources that are available all across Montana, but it's so hard to be able to steer people into the right direction if we're not aware of what resources already exist. So here I listed from the Department of Public Health and Human Services what they have listed for their adult mental health matrix resources available in Montana. And I have a couple of slides that show this PDF of what services are out there and who to contact. And I really would encourage you guys to visit their website. You can see at the bottom of this slide it's sourced, and it will be on each of the slides that I go through here. And so I want you to be able to access these, see what's around your area and what services could be useful to you. But for the point of this presentation, I'm going to focus on one specific service, and that's mental health first aid. So you can see here on this next slide. Other services offered through DPHHS across the state. And I'll be going into mental health first aid just shortly. So I just really want to reiterate the fact that there's a lot going on and a lot of people committed to really improving mental health across the state of Montana. You know, our hospitals and mental health centers and community health centers, clinics, our schools, public health departments, all outreach services. I'm sure I've missed some, but we have people that are very dedicated and willing to provide these services for our population. And I wish I could go through all of them, but in an hour it's a little limiting in the fact that I'll be sharing just one particular training, as I mentioned, mental health first aid. And so I want to be able to share something that I've been trained in, mental health first aid, and then how this can be brought to communities and how community members can use this in addressing mental health issues. So you might be wondering, unless you've already been trained to take the training, but you might be wondering, what is mental health first aid? So there's a national push in trying to make mental health first aid as familiar as CPR. And this is a screenshot from the Washington Post. There was an article that came out in January of this year, really pushing this movement for mental health first aid training. And if I could see any of you in person, I would ask you to raise your hand if you've been trained in CPR or first aid. And I'm assuming there will be several of you that do, but since I'm limited to the vision of just my computer screen, I'm not entirely sure. But assuming that you have, and that is just such a common thing in our schools to be trained in CPR and first aid and making it available in our organizations, how can we make something that we obviously know the prevalence is high enough across the United States? How can we make a training to address this issue in a more common setting? And so the push to making mental health first aid as familiar as CPR is something that needs to be done across the U.S., and we want to be able to share that with you all in Montana so you can spread the word as well. All right, so what is mental health first aid in the first place? Well, it started out in Australia, actually, and came to the United States, and it's operated by the National Council for Behavioral Health and in partnership through the Missouri Department of Mental Health. And the main point of mental health first aid is to be able to help people who may be developing a mental health problem or currently experiencing a mental health crisis, and being able to approach that person and know what steps to take in order to provide them information and calm them down and be able to get them to the resources and appropriate people to be able to help take care of them and provide a treatment if that's what is needed in order for them to get through their crisis. So when I first started mental health first aid, I was trained back in 2013, and there were 5 instructors at that point, and now there are over 75, which is incredible for me to see in the last couple of years. That it's grown so much and that we are making this movement to be able to offer this training to people across all of Montana. So what the course consists of is I just want to make note, it's not a therapy or a support group. It's an educational and informational course like a regular first aid course. It is 8 hours long, and you're able to attend hopefully somewhere close to where you live in Montana. Like I said, there are 75 instructors plus in the state that offer trainings throughout the year. And if you visit mentalhealthfirstaid.org, you can type in your zip code and either go 25, 50, or 100, or I think 300 miles from your zip code to see where the nearest location of training will be held. And from our office, it depends on the person who's teaching it on exactly how much it costs to take the course. From our office's standpoint, when I taught the course, it was free of charge because this was we had grant funds to be able to offer my service to people. All they had to pay for was the course textbook, which was less than $20. But be able to have 8 hours of training to be more aware of mental health problems that are in the U.S. and how to recognize the stigmas and then also defeat those stigmas and really increase their mental health literacy was well worth the day for people to come out and do the trainings. So I will continue on here. What we really want to be able to teach in those 8 hours is that how do you see the person first and not be able to, and stop yourself from reducing them as a person just to the list of symptoms and diagnosis. And you definitely do not come out of the 8-hour course being able to diagnose anything. It's just more of an informative training, but to really be able to demystify the whole topic of mental illness and decrease the stigma. Because when you're unfamiliar with things, it's harder to address them, and mental health is a tough topic. And I know that speaking from myself, before I took the training, I know that I would not have felt comfortable addressing someone or being able to offer resources or information, because it was, to me, it was so foreign of a subject that I didn't feel comfortable being able to offer my assistance. But once I took the mental health first aid training, I definitely was able to build my confidence in helping people. And so this is how we can use a resource within our own communities and using community members to be able to help the people that live in our towns. So again, as I said, being able to grow your knowledge of signs and symptoms and what the risk factors are, how can you identify the types of professional and self-help resources. So if I currently live in Bozeman, and I'm very familiar with what mental health resources are in this area, and especially when you do the training, you become more familiar with those resources. So if I live in a particular town in eastern Montana and my trainer tells me, okay, in this area we have this list of resources, spread the word of what we have available to our community members so that people can access those resources, because it's so hard to go into Google and just type in mental health services, Scobie, Montana, where do I go? What do I do? And it's also hard to get yourself just to Google it in the first place. So having people that you know and are familiar with know the resources that are available makes it so much more of a comfortable experience than often in a challenging time in your life if you're experiencing a crisis. So how the course is set up, like I said, it's 8 hours. Sometimes you'll see it broken into 2 different days where they do session 1, which is listed here on what the overview topics are, and sometimes session 1 on one day and session 2 on another day, whereas other times you'll just do all 8 hours in a day. And I've done that before, and it's long and it's a tiring day, but if you bring enough snacks, people usually can make it through, and it's well worth the 8 hours of training. So in the first session, you go over mental health first aid, as I'm doing with you, what the action plan is, and I will go into that in just a minute. And depression and anxiety are the 2 top focuses of the first session, whereas the second day you get into the, I would say, almost more complex mental health issues that people may have less knowledge about, with psychosis and being able to understand substance use disorders, and being also able to apply that action plan that you learned in the first session to all types of mental health disorders. So just as we go through this presentation, I will be sharing with you an introduction to anxiety and depression due to time, and it's going to be very condensed, again, with the 1 hour limitation. But what's really nice about the training is that you have activities, there are videos that are included, icebreakers, exercises, where for me, that's how I learn best. If there's a certain activity where we are working with a group and brainstorming about things, and that is how I remember things better than just sitting there and being talked to or taught at, because once you're interacting, it sticks in your mind, I think, a little better. Everybody learns differently, but I really enjoy that piece of the course that's offered. So really starting off with, what is a mental disorder? And when I first was trained, I was very limited in this knowledge, and I didn't understand that just a mental disorder or illness is something that affects, the thinking of a person, their behavior, how they feel, and then that it disrupts their ability to be able to work or have relationships or carry out just regular day-to-day activities. And so I didn't understand the degree of the variance of mental health illnesses that people may be experiencing. So it was really good for me to be able to understand what is out there and how those disorders may be affecting people in different ways. And this chart here shows that the list of U.S. or percentage of adults in the United States that have a mental disorder in any given year. And so what was surprising to me is that about 6 adults suffer from a mental illness, reporting an average of 88 days or 3 months during the past year that they were too ill to carry out those daily activities. So there was such a disruption from how they were feeling that they weren't able to have those relationships or go into their daily work without disruption. And that was incredibly surprising to me. One thing you may see was the types of mental disorders listed here in the percent of adults reporting that they experienced these is that it definitely does not add up to that 19.6%, but I want to note that the numbers don't add up because of comorbidity. And nearly half of the people with any mental disorder meet the criteria for 2 or more disorders. So severity of mental health disorders is definitely tied into comorbidity. And a lot of times, like I said earlier, is with people with mental health disorders, a lot of folks delay in getting treatment. And from a national standpoint, the mean delay was reported at 10 years. And that's a long time to delay in seeking treatment. But I definitely understand that delay. And so nationally, then, like I noted earlier on how many folks were receiving treatment, they found that only 41% of people with mental illnesses are using mental health services in any given year. And we know, as our office has gone about the state talking with community members, that they are seeing a lot more mental health cases coming in over the past several years. And I think part of that is due to the fact that people are becoming more aware of those resources, but I know that it also can lead to provider burnout because there's so many cases and we do not have enough providers to assist with those cases in offloading that burnout. So as I mentioned with disability, there were a couple of points from the training that hit home for me in just how disabling mental illnesses can be. And so I have 2 slides here that give examples of the disability from moderate depression is similar to the impact from relapsing multiple sclerosis, severe asthma, or chronic hepatitis B. And I think when you're teaching community members, what I love about mental health first aid is that it puts it in realistic terms. And so when you're teaching community members about mental health, they're able to compare it a little bit better if you put it in terms like this, because then you're like, oh, wow, that is very disabling, whereas it's hard to wrap our minds around just how disabling mental illnesses can be when you have minimal or no experience in this area, or working with people who may be experiencing or talking with people who may be experiencing mental illness, or having friends who may be experiencing. And so being able to understand just how disabling it can be is really helpful to really wrap your mind around as you go through the training. So here's another one of a comparison too that you guys can look at. So the spectrum of mental health interventions, where mental health first aid comes in and is the most helpful in the mental health intervention spectrum is that you're able to help prevent mental illness as serving as a catalyst for treatment and recovery. So rather than having people prolong that time to go seek treatment or ask for help, the mean of the nation is 10 years that you can step in and be able to be an advocate for treatment opportunities or self-help groups or just personal health groups, and knowing what your community offers and being able to provide that information to people who would most greatly benefit from it. So really between, as you can see in the green, from the point of becoming unwell to unwell. And I think that prevention piece, our communities are doing a lot for prevention. We know that having exercise programs and support groups and wellness, our worksite wellness programs, all are huge in being able to create prevention activities for mental health related cases, but oftentimes that's too late, or sometimes it's too late, and so being able to have early intervention is also very key. And helping those who are well or may have mild symptoms, and to be able to prevent them from moving into a more challenging phase in their lives. All right, so this fun algae is the first step, or it's a 5-step action plan that mental health first aid uses. And it's much like first aid or emergency situations where you know that you learned your ABC. So with emergency situations, checking your vital signs with the airway, breathing, and circulation. Algae is the mnemonic that we use in mental health first aid. And so I'll be going through the steps with anxiety and depression. Again, this is not the full training of mental health first aid for those 2 mental illnesses, but I want to give you guys an idea of what you'll be learning by taking the course, and then what people are able to take away from it in using this action plan in real life situations. So I'll go ahead and get started in these 2 topics that we'll be covering today. So with depression and anxiety, these are our most common mental illnesses, and a lot of times there are similar signs and symptoms and also can frequently co-occur. And so it can be challenging to understand the difference and then being able to recognize that difference. And a lot of times we get stuck on the signs of what we can see and don't always understand the symptoms, because those are what the person experiences, and we usually just see the signs. But to know what symptoms someone's experiencing definitely increases your knowledge about mental health and what you can do to aid those who may be experiencing a crisis. So with depression, it's defined as a major depressive disorder, or a major depressive disorder is one that lasts for at least 2 weeks, and then in turn affects that person's emotions and thinking, their physical well-being, how they behave, and as I said before, with anything that's disabling, their ability to work and have those satisfying relationships. And here this lists what are the signs and symptoms of depression. So the physical signs and symptoms, fatigue, lack of energy, you're either sleeping a lot or you're not sleeping enough, loss of appetite, maybe some unexplained aches and pains, weight loss, weight gain. So it's kind of a variety there physically. So it may be challenging to see that just from one person to another, of noticing that difference. Also, behavioral, crying spells, someone's really upset, that may be something that begins to show that activity that's not a normal, and by normal I mean what you're used to seeing that person act like. If that's something that is not of character, then it's definitely something to note. Loss of motivation, increased use of drugs and alcohol. A lot of times I want to make note that people with depression don't necessarily have all of these signs and symptoms. It could be just a few of them or one or the other, and it can be challenging to notice. One thing that we've heard a lot is that in the workplace, it's easy to see or it's easy to think that that person may be acting like standoffish, or maybe they're acting selfish, or maybe you think that they're just being lazy because Johnny hasn't gone to work on time and he keeps showing up late because he's been sleeping in, and it's easy to think and assume that that person is being lazy, whereas there may be something a lot bigger happening to that person that we should be able to recognize and address, and hopefully be able to provide information and resources to that person so they can make improvements in their life and feel better. And it's really important for individuals with depression to tell their health professional about their emotional and cognitive symptoms instead of just the physical ones. It's so easy to only note what is physically ailing you, whereas emotionally and cognitively, that really helps our healthcare professionals understand more of what you're actually experiencing and what the best options can be for them to help you. So one thing that we explained to those in the training, that asking people about how their mood has been and how they're feeling can really help encourage people that are experiencing depressive symptoms to open up about how they really are feeling. In anxiety, we often hear us, just in daily conversation of how anxious you are, but an actual anxiety disorder differs from just the normal daily stress and anxiety that we feel on a day-to-day basis, but it's something that is much more severe and lasts longer, and again, has that disabling effect into a person's daily life. And this chart here shows the U.S. adults with an anxiety disorder in any given year, and it lists the types of anxiety disorders which are taught in the mental health first aid in detail. And with that manual I had mentioned, it has all of this information listed out for community members or people that take the class to be able to reference back to and refresh their minds on the different types of illnesses and disorders, because I know it can be a lot just to learn in 8 hours. But approximately from this chart, you can see 19% of U.S. adults experience an anxiety disorder in a given 12-month period. Typically, anxiety disorders are more common in females than in males, and the median age of onset for an anxiety disorder is 11 years, and they stated that of half of the people that have their first episode of an anxiety disorder by this age, so at 11, typically experience more anxiety, prolonged issues as they progress through adulthood. I just want to make sure to note, too, that this doesn't add up to 19.1% again just because of comorbidity, as we discussed earlier in the presentation, for those experiencing more than one anxiety disorder, and that often happens especially with mood disorders and substance use disorders. Those are oftentimes going hand in hand because people are trying to provide treatments to themselves, so self-treating, self-medicating with alcohol or drug use. All right, and another thing is that a high level of anxiety over a long period of time a lot of times can lead to depression, so it's very common for people to have a mix of both anxiety and depressive symptoms at the same time. And then we have here the signs and symptoms of anxiety, which shows then the difference of those signs and symptoms from anxiety and depression. Another thing to keep in mind, too, is with these physical symptoms, if someone has a lot or is showing a lot of the physical symptoms, they could be experiencing troublesome anxiety, or also these are very similar symptoms to a heart attack. So that's something to keep in mind in being able to communicate this with emergency medical system and receiving appropriate treatment if that is the case. Another thing I want to note is that the course goes over the risk factors for both depression and anxiety and really helps outline where it's more common to see anxiety and depressive symptoms based on different risk factors of different people across the population. Okay. So back to our 5-step action plan. I want to go into detail of how this works. So the first letter, we have A, assess for risk of suicide or harm. And that is what you'll learn through taking the course. Really what is the most important step in mental health first aid is being able to identify if there is a risk of suicide or harm, if there are suicidal thoughts or behaviors. So it's definitely an important step to not skip over when addressing a crisis and helping a person. And this sometimes, from the courses that I've been in, people have expressed that this is sometimes a more uncomfortable step, but it's definitely necessary in making sure that the person is going to be okay, or if they need immediate medical attention, and if they are safe to be left alone or not. So once you've approached and engaged a person that may be experiencing a mental health challenge or illness, you need to make sure to know if they're in crisis, and particularly if they are suicidal. And there are certain factors that are associated with someone being suicidal. Now, this is mapped out through mental health first aid, but by all means, it's not lumped into one category of this is absolutely true for everyone. But what research has found is that regarding sex, males kill themselves 4 times more often than females, even though it's reported that females attempt suicide more often. Certain age groups are more at risk, including adolescents and older adults. Mental illness is, for those that are depressed, they typically are more prone to suicide. But of course, not everyone with depression will be suicidal, so keep that in mind. And oftentimes, they've found that alcohol abuse is implicated in suicide, and that lack of social support definitely makes a difference in having those thoughts. And if you're able to have a group of people or a person there for you during challenging times. 2 things from this slide is that the most significant factors in the suicide risk assessment is previous attempt and an organized plan. And here we have the warning signs of suicide. How you can look through, and through the course you'll spend a lot more time understanding the warning signs of suicide, but again, for this hour, I'll just go through this quickly, but it's definitely something that needs to be spent, time needs to be spent on. But being able to understand and recognize if that person is at risk of suicidal thoughts or actions. And so if by addressing that person and asking them directly whether or not they're suicidal, which is really challenging for a lot of people, asking if you've ever had thoughts of suicide, or if they have a plan, ask more about that to be able to fully identify if that person is suicidal. One myth that we like to make sure we bust is by mentioning suicide that it does not plant the idea of suicide in a person's mind. I know that it can be uncomfortable asking about someone's plans or intentions, or if they have ever thought about it, because a lot of times people will get defensive, but it's something that needs to be done, and that step that needs to be addressed in order to make sure that that person is going to be safe if you walk away. So if that person has, if you've clearly identified that that person is not suicidal, then you can move on to the next step in ALGE, which is L, and I will get to that in just one moment. But for those, if you are concerned that they are suicidal or they have expressed that is a possibility, then just being able to let that person know that you're there for them and can talk with them without having any of your own opinions or ideas expressed to them, but just being able to be there for them in that moment, and then follow through with the rest of ALGE and offering support and resources. And of course, keeping that person safe. So being able to offer your phone number or call law enforcement if there's, or an EMS if there's someone that can help directly, and to just be sure that you do not leave that person by themselves or try and use guilt or threats to convince them that suicide is not the right option for them. And also do not agree to keep their plan a secret. I know that can be challenging because you're trying to buy trust with that person, but you have to be able to be honest with them. And so that is a very important piece of keeping that person safe, is being honest. And one thing that we like to share this phone number no matter where you're at in Montana or the nation. If you have cell phone service, you can use this Lifeline phone number, and if I saw you in person, I would tell you it's okay right now to pull out your cell phones and put this number in your phone. But again, I can't see you. So if you are even near your cell phone, you certainly can put this number in to save and be able to share with other people. But this is a 24-hour national suicide prevention line that people can call just if they need support, someone to talk to, if it's too complicated to call your neighbor or someone in your community because you're uncomfortable or you don't want your community to find out what's going on, please call this number, and it's toll-free, so feel free to share that as a resource. So L, listening non-judgmentally, and I will hopefully get through all of these without skipping anything based on time, but listening is hard. That's an understatement right there, but a lot harder than we think, and a lot of times, because it's so easy to want to be able to offer support without fully listening to a person, and you really lose their trust by not listening completely and not giving all of your opinions at once. I know we know a lot of things, and community members know a lot of things, and the person down the road knows a lot of things, but being able to give your undivided attention to that person and really being able to focus on both those verbal skills, but also your nonverbal skills. So eye contact and keeping open body posture. If you're talking to someone with your arms crossed, that automatically makes them think and feel that you're not open to the discussion that they're having. So why would I want to tell you how I'm feeling at this moment? If you're seated, it oftentimes makes someone feel like you're not in a rush to go, and so that they have your time and attention. And when you're sitting next to them, it is able to create more of a safe environment where they can share with you how they are feeling without having distance between the two of you. And so again, just please set aside your own beliefs and reactions, and that is hard to be able to control your own reactions too. My facial expressions show what I think, so just being able to be cognizant of that, because one negative reaction can cause a person to no longer feel safe, and you would rather be able to offer that support and information than losing that person's trust in you. So G is giving reassurance and information, and this is where we can really help out our communities in sharing the information that is available in regards to resources in the area. So if you have a support group for kids, or a youth dynamics, or after school programs where they may have this built into their curriculum, or at the hospitals, if you offer, or clinics, you offer different types of group activities where people can get together and talk without necessarily having a title of mental health support group. You know, trying to make it more of a community feel, but making sure that people who are trained in mental health first aid and who live in our communities can share this information and speak with confidence about it because they are aware of it and understand what services are available in their area, where it's not so foreign to us to make us look it up and be like, oh, I don't know if my town has this, because we want to be able to make it commonplace and known knowledge that there is common, there's high prevalence, and there can be access even in the smallest of towns. Just to highlight on a few things that are not supportive, telling the person that they need to get over it. It's so easy with family and friends where if they're having a tough time, it's easier for you to just say things like, oh, I'll get over it, you'll be fine. But it might not be something that they can just get over. So again, making sure that you're using positive body language and words in addressing these types of situations. So 2 more steps left of the action plan. Encourage appropriate professional help. We have access, what sometimes may feel limited in the state of Montana, but what access do we have and how do we familiarize ourselves with the professionals who are available in our area? Where are our mental health centers? Where are our community health centers? What does the hospital have? What about our clinics, public health? What do our schools offer? So understanding through the course who you can access and provide information about in regards to seeking care. And we have encouraged self-help and other support strategies as the last step in the action plan. And I mentioned this earlier. I know a lot of communities are using activities within their community to try and build social and mental health type support without even really thinking that this is going to benefit mental health in the long run, but having exercise groups and those peer support groups, walking trails, gardening, having a town garden, like something where people can feel more involved in the community, because if they already do not have that social support at home or are unable to engage in satisfying relationships, we can build those relationships elsewhere. So something to think about, what is your community doing to be able to create friendships and relationships in your town for people to have access to? Because if you can do the preventative step before and not have to get to that next step where mental health first aid is even needed, then that makes things even easier, because people are able to have a better mental health in general before things progress. I wanted to make note too that let's see. Most people have told us, our office, from traveling across the state, that they usually are seeing a primary care physician, and a lot of times we've heard that they're more comfortable talking to their primary care physician in the first place. So that is sometimes an easier step of just recommending, like, hey, can you talk to your doctor? So if you've completed mental health first aid or you haven't, and you recognize that someone may be in a challenging state of their life, that recommending to go to their primary care physician is a good first step too, because they typically have the resources that they can use in your community, such as the peer support groups or other types of social settings that like Alcoholics Anonymous or Narcotics Anonymous that are more common across the United States, that they can reach out to them too in case you don't know about services in your area. But one thing that is beneficial is learning about the services that are in your area so you can be mental health advocates for all of those in your community. If you live in a really large town, I guess a city, there are typically more services available, but you definitely be able to memorize those. You can a lot of times send them to that's a particular website within your community to direct people, but primary care physicians is what we've found to be a first stop for most people that are experiencing some sort of mental health challenge. So a couple last statistics here in regards to self-help groups, that a lot of times people have an associated stigma with self-help groups even, but again, that they're more common than not, and it's definitely there are resources that are available not in all communities, but if it's something that is available, helping people understand that it's that they're not the only one is experiencing this is definitely useful in being able to seek treatment and feel better in their life. So I encourage you all to access mentalhealthfirstaid.org. That's the website again, where you can go in and look at where the next trainings are. Maybe it's something that you want to be able to refer other people if you're in a healthcare facility or any facility. Say, hey, we need someone who is aware, like trained in this area, so we can provide support in case this comes up, or then we have a go-to person. We have that advocate. If you want to become a trainer and teach courses, it takes it's 5-day training. They have them across the U.S. at different locations. And it typically costs your organization or you personally about $2,000 for the 5-day training to be able to teach the class to others. But at any rate, I think being able to become certified in mental health first aid is a great first step, and you're able to help those in your community in more ways than you may expect. I know that I've used it and am able to share this information with other people, so that is why I wanted to share it with all of you. And with that, I think I might have like a second for questions, and I'm not entirely sure how to access that, Amy, so.
Okay, I've been telling people to type in the chat box
okay.
questions, and they've been doing it, but I think that they're only being able to be sent to me.
Oh, okay.
Or perhaps to you as well, if you can. Are you seeing anything in the messages?
Yeah, I have a couple. So one person did mention bringing up youth mental health first aid, and I'm so sorry that I saw that just in my own discussion. I had written it down. But there's mental health first aid for youth as well, so not just adults. What I was referencing was adults. That's the training that I was trained in, and then the courses that I've taught. But there is mental health first aid directed for those that are young, and it's tailored in a different way to be able to be understood by our younger folks out in our schools and communities, and definitely makes a difference. And we have a couple of other comments here. Rhonda Stevens, thanks for writing in. She says, they are training hundreds of people in the state with the youth mental health first aid, and that Montana SOARS, so S-O-A-R-S grant, is responsible for the training. And so again, that's focused on the youth, and an incredible way to be able to help those that are younger be able to help identify mental health illnesses and challenges. And because a lot of times we go to our friends, and when you're young, 18 or 12 to 18, with the mental health first aid for youth is definitely a good way for our kiddos to be able to help out other kids, because we're seeing an increase in mental health challenges and suicide rates for those in Montana that are under the age of 18 as well. Any other questions or comments?
I'm not getting any.
Okay.
If anyone wants me to unmute their line, they can type in and I can unmute you. Okay. Well, if that is everything, thank you, Kailyn, for sharing your time and your expertise. A recording will be sent to everyone after the conclusion, and as soon as we're done, a survey will pop up. So if you could. Oh, I have another one. Here's what's Kailyn's contact info? So I'll just type that into the group right now.
Perfect.
I'll give your email. So it's kailyn.dorhauer@montana.edu.
Yes.
So.
Complicated enough name that makes for a long email, but please feel free to reach out to me if you guys have any questions, or if I can help any other questions you may think of after the presentation is over. And I thank you all for your time. Hopefully I didn't talk too fast and appreciate your attention.
All right, thanks, Kailyn.
All right, thank you.